am thrilled and excited to introduce to you Nashon Hornsby. Nashon is a first-generation college graduate, a native of Neptune Township, and he's an alumnus of Brookdale Community College, where he earned his associate's degree in political science, magna cum laude. He earned a bachelor's degree in business management after that, cum laude, from Morehouse College. And then following graduation from Morehouse, he returned to his home state of New Jersey and attended Seton Hall University Law School, where he earned a Juris Doctor degree and a legal letter master's in health law. Licensed to practice in the state of New Jersey, Nashon has served the state of New Jersey for over 15 years. In his current post as Chief of Operations for the Office of Policy and Strategic Planning in the New Jersey Department of Health, he advises the Office of the Commissioner regarding policy and planning, including the reorganization of the Division of Mental Health and Addiction Services from the New Jersey Department of Human Services to the Department of Health Oral Health Policy and Workforce Development efforts to increase the number of providers practicing in the state to deliver services to underserved populations. So we are really thankful to have you here with us today, Nashon. I'm going to turn it over to you.
Thank you so much. First, I have to say, my buddy, Dr. Halkitis, love you, man. One of my favorite people, period. But I also want to say that I'm so excited that I get to have the privilege of being between Dr. Halkitis and Dr. Purnell, also a giant in health equity, and someone who does not know me personally, but who I just am a big fan of. Every time I see her on TV speaking about the importance of building confidence around what we're doing relative to COVID-19, I really, really love seeing her because she reflects the community and does so so very clearly and effectively. So we're going to go through these slides quickly because I want to make sure that that I can see if there are any questions in the chat box and that I can respond to them and still not put the summit totally behind schedule. And so let me start by saying that the goal of this presentation is to really talk about what my division is. I serve as Assistant Commissioner in the Department of Health and have really had the privilege of building programs similar to Perry. I saw the need to change the way we're doing things in the Department of Health, and we have worked collaboratively with the School of Public Health, but also have changed the structure of what we're doing internally, because he is absolutely right. We were thinking far too much about population health and looking at policies and not really looking at how we bridge the gap between what is being done within the community setting. So the second of the pieces that I will cover is really some of the structures that we work with federally. Our partners at HRSA is one that I'm going to talk about today. I'm also going to talk about a little known program around looking at healthcare shortage areas within the state. We really don't understand what our public health agencies are doing sometimes because we don't, as a public health agency, publicize some of the behind the scenes work that we do to really build workforce. And I thought this was a great audience to share some of that with. And then finally, I'm going to talk about some of the emerging workforce opportunities as I see it. So what is the Office of Primary Care and Rural Health, which falls within my division? The office is a very small staff of individuals. There are 4 individuals that work in the office, focusing in on primary care and rural health, but also focusing on the bigger picture, which is how do we ensure that vulnerable populations have access to care? What are we doing specifically on a day-to-day basis to improve quality and to make sure that there is a sufficient quantity of high-skilled healthcare professionals to meet everyone's needs, not just those who have insurance, not just those who have an ability to pay out of pocket, but for every resident of New Jersey, irrespective of their legal status, just making sure that we are very mindful that the least among us must be healthy, especially now in a pandemic. We have no time, no tolerance for hierarchies of care. So the next piece regarding this office is that the program of primary care focuses on some pillars: access, workforce development, primary and preventive care. And that is not just medical care, but it's also dental. And we're doing more and more in the behavioral health aspect as well. We cannot lose sight that people are have many complex needs that they present with. They're not just one-dimensional. And so we need to make sure that we're providing for the full needs, the integrated needs of individuals, and making sure that we're doing so in the most efficient and effective fashion. And finally, rural health. Most people don't think of rural when they think of New Jersey, but New Jersey does have areas that are rural. You know, tell someone up in Warren County that we don't have rural New Jersey, or someone down in somewhere like Gloucester County, the outskirts of Gloucester County. We do have rural New Jersey, and our definition that we use in New Jersey is areas where there are 500 or less persons per square mile. And so in those areas, we still have access concerns. We have concerns also when we look at the disparities, when we look at the healthcare disparities. And while I agree with Perry completely that public health is not about epidemiology solely, it does help us to paint the picture of what our needs are and what we need to be focusing in on and targeting, as he also pointed out. Next slide. So let's talk about our friends over at HRSA. The Health Services and Resources Administration is a federal agency within the U.S. Department of Health and Human Services, and they are really focused on improving the health for those who are disparately impacted, those who are geographically isolated, those who are economically or medically vulnerable, and who have not received the levels of care that they deserve and that they need. Among those populations, you see that they identify on in HRSA on their website, they identify HIV/AIDS patients, and I'm going to put in the chat box at some point a link to them so that you can look up their information. But HIV/AIDS patients, pregnant women, infants, children, adolescents, and mothers, those are specific populations that they are concerned about. But I'll add to that list beyond what they have on their website. They're also focused about the homeless. They're focused on migrant populations, and they are very concerned about making sure these days that we are looking at those who are undocumented and ensuring that there's access to care for those additional populations. So what does HRSA do in response to that? Part of it is that they provide funding to various agencies, state agencies, as well as local community-based organizations, but they provide training opportunities for health professionals as well. Most people don't realize it, that HRSA is one of the largest funders of student aid for individuals who are entering into the health professions. They have programs that you'll see in a little bit on some of the later pages, but that are providing opportunities for scholarships, fellowships, and the like for individuals who are entering into the workforce who are committed to serving the vulnerable populations. They specifically have the Bureau of Health Workforce, which is its mission is to strengthen the health workforce and to connect skilled professionals to all of the communities in need throughout the country. Next slide. So their structure, I'm not going to linger on this. Let's go to the next slide. So the Bureau of Health Workforce, it has a lot of different programs, as I mentioned a short while ago. They provide scholarships, loans, loan repayment for health professionals, for those who actually have amassed significant loans while they have studied. There are ways to have those loans paid off by the federal government in exchange for commitments to serving communities that are most at need. They also provide health profession training grants. These are specific grants that are extended to institutions so that those institutions can support the health professions. They engage in strategic partnerships. Clearly, there's a shortage designation unit within HRSA. They perform analyses of the workforce on a regular basis, collaborating with state agencies such as mine within my office. And then they have and manage what is called the National Practitioner Data Bank. And that data bank includes information on all practitioners across the country, where they're required to have a specific unique identifier per provider so that we can track how many providers do we have, where are they, where are the areas of need. And so these are some of the descriptions of the workforce activities out of HRSA's Bureau of Health Workforce. So let's talk shortage designations. So these designations are established to recognize where are the areas of need. And I'm going through all of this. You may be wondering, why does this have to do with workforce? Our workforce has to be strategically placed. Too often, we have trained individuals for careers, but we haven't told them where to go in order to fill the need once they are completing their education. Where are the areas within states in order to work to actually not become oversaturated and find yourself having a difficult time finding, placement? There are areas of the state, every state, that are considered health professional shortage areas. They're HPSAs. And these are designations that are identified and created by HRSA, but they're created with a formula that I'm going to share with you in the next couple of slides. Medically underserved areas and medically underserved populations. These are also designations that are found on the HRSA website. In addition to me providing you a link to HRSA generally after my presentation, I'm going to provide you the link to where you can find these HPSAs, MUAs, and MUPs. These areas are used for a lot of programs. They're used for federal programs, they're used for state programs, and they're used for determining whether individuals can receive some of the funding that I just mentioned on the prior slide, whether they can be funded for scholarships, for other opportunities, because they're serving individuals in these vulnerable communities. There's state designations through the Medically Underserved Index, but that's less used. And then let me just describe very shortly that the reason why it's important to track these HPSAs, MUAs, and MUPs is because the HPSAs, for instance, are used for scholarships, for loan and loan repayment programs, as well as what is called the J-1 Visa Waiver Program. That program is a nationally recognized program with the U.S. Department of State to allow for up to 30 licensed practitioners to reside and work in states throughout the country in exchange for them committing to 3-year minimum of serving in vulnerable populations within HPSAs, MUAs, MUPs. And so most people don't know about the program. They don't know about these acronyms that I've thrown out. But I want you to know today that there are areas of the state that are specifically considered vulnerable. At present, our Office of Primary Care and Rural Health, we work collaboratively also with our states for psychiatric hospitals. They are considered, 2 of them are considered HPSAs. Our federally qualified health centers in the state, there are 23 of them with over 130 sites. They are considered to be HPSAs. Medically underserved areas and medically underserved populations are dispersed throughout the state in various communities. So I will, again, share with you the link on where you can pull them up, where you can look at where they are, but know that my staff is working on a regular basis on updating where our shortage areas exist. And we are constantly trying to expand the number of areas that are identified so that we can identify the areas where employers need to be focusing their efforts on placing workforce. So the alternative placement programs that exist, there is one with the U.S. Department of Health and Human Services. It's called an exchange visitor program that is similar to the J-1 visa waiver for foreign doctors who want to work in the state, and they can serve mental health services or medical services. They don't have one for dental in that program. There's also what's called the National Interest Waiver Program, and it is for individuals who have at least 10 years of experience and who are exceptional practitioners that can come and work in various states as well. And that one is approved by the U.S. Citizenship and Immigration Services. Next slide. Now, the health professional shortage area designations, here's the actual link in this slide, embedded in the slide. And I think you all would get the slides, but, oh yes, Sandra's saying yes. So you'll see that on that slide, you'll be able to actually find the health professional shortage areas. And there are three types. There are geographic, population HPSAs, and facility HPSAs. In New Jersey, our facilities that have HPSAs are FQHCs, some of the psychiatric hospitals, and correctional facilities. Geographic is something that we're currently working on, and we are going to be seeking approval from HRSA to expand into local communities with those geographic HPSAs. Once we have those, it will expand the number of areas that are considered underserved so that we can, again, apply resources to those communities. You see there's also information on medically underserved areas and medically underserved populations. That index that we talked about earlier is based on 4 measures: population to provider ratio, the percentage of the population below the federal poverty level, and the percent of the population over age 65, as well as the infant mortality rate. There's a score of 0 to 100 with, and you're wanting your score to be lower than 62. If it's lower than 62, then you're designated as an MUA, MUP. And next slide. So now the role of our commissioner. The commissioner of the Department of Health, Judy Persicelli, is our commissioner. She is the one who is responsible for serving as the governor's representative with the federal government around these programs. I mentioned a lot of them relate to foreign doctors. And so when you're talking about immigration policy, you absolutely must have the executive involved in those discussions. And the executive, however, can designate an individual within their administration. And Judy Persicelli is New Jersey's designee for these programs around shortage areas. The primary care office within my division of community health services, we advise the commissioner, and we then take a whole packet of materials for submission to the federal government, present it to the commissioner with our recommendations and letters for her signature for them to go out to the federal government. We can receive MUA, MUP designations by submitting requests with supporting documentation from the governor to the commissioner, and from the governor and the commissioner that go up to HRSA. And HRSA has in the past granted those, and so that's another function of the commissioner. Next slide. Now, our performance metrics on HPSAs. We are in a modernization project where HRSA has been focused on revising its approach to designation areas, and New Jersey has been doing well in that regard. We have moved up from one of the lower tier of states when it comes to showing shortage designations. And again, because most people don't understand New Jersey and they think that all of New Jersey is densely populated and that there are tons and slew of doctors and other health professionals everywhere, and that there are very few who have access concerns. Well, we have been changing that understanding by sharing with individuals geospatial mapping, sharing with them our specific numbers of providers to patients, the distance from the providers to, from the patients to their providers in the area, and also showing them where there are gaps when it comes to public transportation and the like. Next slide. So these are the score criteria that are used. For the primary care score, there are 3 types of HPSAs. There's primary care, dental, and mental health. And so for primary care, the top score that you can get, and you want your score to be high here, the top score is 25. 10 points are provided based upon the population to provider ratio. The lower the number of providers in an area to the population, the higher the score. The percent of population below 100% of FPL, federal poverty level, there's another 5 points there. And then there's an infant health index based upon the infant mortality rate or low birth weight rate. Can we go? Yes, 5 points there. Then there's travel time to the nearest service provider. That's 5 points. The dental HPSA is measured in a similar way, 10 points for the provider to patient. The percent of federal poverty is 10 points here. Then they have one for water fluoridation. And that's the amount, whether the community in the area of the HPSA has community water fluoridation. Interestingly to note, New Jersey is the second worst state in the country when it comes to water fluoridation. We only come behind Hawaii. And we only have about 18% of the residents of New Jersey that have access to community water fluoridation. So we typically get this point. And then the travel time to nearest service provider. And finally, on the mental health, which is the next slide, mental health score. This one is another 25 points, but it's different than the others. Population to provider ratio, there's 7 points there. Percent FPL, 100% of FPL is 5 points. Elderly ratio, there's 3 points there. Youth ratio is 3 points there. Alcohol abuse prevalence, substance abuse prevalence, 2 points between the two. And then travel time to nearest provider. We track all of this information on a regular basis in my unit to identify very, very closely the communities that are in greatest need for this designation. And it's very key because, as I said before, all of those federally funded programs are tied to these HPSAs. And we need these to be very accurate the way that we calculate them. Next slide. Now, I'm just going to spend the balance of my time, and I know I'm running over, but I'm going to spend the balance of my time talking about the health professions that are emerging. And I can certainly enter into chat for any questions that come up later, and I won't take the next speaker's time. But these are the professions that I think, from my perspective, are emerging these days. Community health workers, patient navigators, contact tracers, as Perry mentioned, data analysts. There's always a need to be able to identify where are the greatest areas of need and what are the needs. Dental hygienists, nurses, doulas, certified medical assistants, physical and occupational therapy assistants. These are the types of professions that some of them, and also I should mention behavioral health services as well. These are the types of professions that I think we need to be focusing in on when we're talking about our community colleges, and also through the extension, our four-year institutions and our graduate institutions. Certainly, of course, doctors are important, but there are so many other health professions that make up the workforce that are going to be critical to addressing not only the long-term needs of New Jerseyans, but in this immediate time when we're facing this pandemic, we really need to make sure that we have all of these professions available where they're at a community level, building the trust with residents of the community. Most often, we find that some of the disparities that we are trying to tackle are because of a lack of trust. And that lack of trust was actually structural. It was built through history of racism, implicit bias, current implicit bias. And so we really need to be very careful to make sure that we are working actively to build back the trust, and in some cases create it where it never existed. And so with that, I know I rushed through my slides. I hope that I've provided some information that is helpful to all of those involved. And as I said, if any questions come up, I will be checking the chat box, and I will also send a few links at this time. Thank you.